Next, we have Zach Shamberg, President and CEO of Pennsylvania Healthcare Association. Thanks for participating. Please begin.
Thank you. Members of the Senate Aging and Youth and Health and Human Services Committees, good morning, and thank you for the opportunity to participate in today's hearing. My name is Zach Shamberg, and I am the President and CEO of the Pennsylvania Healthcare Association, better known as PHCA. PHCA is a statewide advocacy organization representing long-term care, including nursing homes, personal care homes, and assisted living communities. Now, I've been told I have 5 minutes to deliver my remarks this morning, so let's get right to the point. Long-term care facilities, specifically nursing homes, have become the epicenter for this virus in Pennsylvania. And as we heard earlier, the numbers are staggering. More than 500 facilities statewide have reported at least one case of COVID-19, and nearly 70% of all COVID-related deaths in Pennsylvania have occurred in long-term care. Now, with numbers like that, you'd think any state response would not just include nursing homes and long-term care, it would make them the focal point of that plan. Yet here we are today. We knew the risk. The first reported cases of COVID-19 in the United States occurred in a nursing home in Washington state. We knew senior citizens would be more susceptible to this virus than any other segment of our population. And nursing homes care for those seniors who often have those comorbidities and underlying conditions. We knew carriers of this virus could be totally asymptomatic. In other words, they have the virus but exhibit no symptoms. So our staff can walk into a facility and by no fault of their own, unknowingly transmit this virus. We also knew the virus was highly contagious, especially in a contained area. And beginning in late February, we warned of what was to come. When those first cases occurred in that nursing home in Washington, we reached out to our counterparts there and we wanted to learn, what should we be prepared for here in Pennsylvania? And immediately we began to work with our state government. That was early March. Then we saw the first reported cases in Pennsylvania. So we restricted all visitation, but providers started to run low on PPE. They couldn't obtain the equipment necessary to mitigate the spread of COVID-19. And who actually had the virus? They couldn't test their residents because there were limited capabilities, and they certainly couldn't test staff. So we continued to work with our state government. And as the cases multiplied and staff left our facilities for fear of contracting the virus, and our residents, who are our parents, our grandparents, our relatives, our loved ones, began to succumb to this virus, we went back to state government and we pleaded for help. And that was mid-April. Members of the Senate, today is May 7th, and the critical initiatives that we're fighting for today are the same exact needs that we've advocated for since this epidemic began more than 2 months ago. Priority testing for workers and residents, all workers and residents, symptomatic or not. Priority personal protective equipment, critical emergency Medicaid funding, liability protections, and collaboration with our state government rather than misdirected regulatory oversight. Now, I can't sit here and tell you that any of those needs have been granted to long-term care facilities. Again, the epicenter of this epidemic. Now, you could be skeptical in late February, and you could be hesitant in mid-March, but not in the first week of May. Members of the Senate, you've seen the numbers. The data doesn't lie. 70% of all statewide deaths are occurring in our facilities. So what are we waiting for? We must begin testing every resident and every staff member today. It is the key to reopening Pennsylvania. Now, other states, including West Virginia and Maryland, have prioritized testing in long-term care. Maryland even has strike teams. New Jersey just doubled their testing capacity. Massachusetts is working with the National Guard to test everyone in nursing homes. But here in Pennsylvania, we're exploring pilot programs. That's not good enough for our seniors. We must prioritize PPE to long-term care because today providers feel as if it's every facility for themselves. But every study shows that this equipment limits the spread of COVID-19. So if long-term care is truly the epicenter of this virus, shouldn't our frontline staff be receiving priority PPE? That's not good enough for our frontline workers. As Adam said, we must send critical Medicaid funding to nursing homes. The sheer magnitude of our expenses cannot be ignored. Hazard pay, bonuses, wage increases for every staff member, which they deserve. And yes, providers across the state were thrilled to see that the Senate Appropriations Committee invested $200 million for nursing homes last week, and we commend you for that investment. But that can't come soon enough. And finally, the impact of liability protections for providers and for workers cannot be understated. We would ask you to stand up, as legislatures and governors in 13 other states have already done, and grant liability protections to our facilities. Yesterday's executive order was not good enough. So I'll close by saying this. This is not over. It's not too late. Some say long-term care has been forgotten in this epidemic, and I disagree. I think long-term care has been ignored because the providers and the workers that I represent and that we represent are pleading for the things that I just outlined, the critical tools that they need to mitigate and contain the spread of this virus. And so far, those requests have gone largely unanswered. You can answer them starting today. Thank you.
Thank you, Mr. Shamberg, for your powerful testimony.